This video is going to cover information regarding facial surgery. This will include information for facelifts, eyelid tucks, also known as blepharoplasty, and nose surgery, also known as rhinoplasty. I have combined these topics because they are oftentimes performed on the same day. If you haven't seen the video on the general risk of surgery, please watch that one first. I would recommend that you try to follow along with your written consent and post-op discharge documents. Please pause the video and write down any questions you may have so we can be sure to get you all the information you need before making an incision to proceed with surgery. It is important that you read all this information carefully and completely. Please initial each page indicating that you have read the page and sign the consents for surgery in the presence of one of my staff members so that they can act as a witness to your signature. By signing, you agree that you have an understanding of the risks and benefits involved, that you have had the opportunity to have your questions answered to your satisfaction, and that you are requesting that this procedure or procedures be performed on you. General information on facial surgery. A facelift, or rhytidectomy, is a surgical procedure to improve visible signs of aging on the face and neck. As individuals age, the skin and muscles of the facial region begin to lose tone and elasticity. The facelift cannot stop the aging process, but it can improve most of the visible signs of aging by tightening deeper structures, redraping the skin of the face and neck, and removing selected areas of fat if necessary. A facelift can be performed alone or in conjunction with other procedures, such as a brow lift, liposuction, eyelid surgery, nasal surgery, or with fat grafting. Facelift surgery is individualized for each patient. The best candidates for facelift surgery are healthy individuals who have a face and/or neckline that are beginning to sag, but whose skin has good elasticity and whose bone structure is well defined. Blepharoplasty, or eyelid tuck, is a surgical procedure to remove excess skin and muscle from both the upper and lower eyelids. Underlying fatty tissue that produces bagginess can also be removed or repositioned. Blepharoplasty can be improve drooping skin and sagginess. It can help improve vision in older patients who have hooding in their upper eyelids. Although it can add an upper eyelid crease to an Asian eyelid, it will not erase evidence of one's racial or ethnic heritage. Blepharoplasty will not remove crow's feet or other wrinkles, eliminate dark circles under the eyes, or lift sagging eyebrows. Blepharoplasty is surgery that is customized to every patient depending on his or her particular needs. It can be performed alone, involving upper, lower, or both eyelid regions, or in conjunction with other surgical procedures. In some patients who have looseness between the lower eyelid and the eyeball, consideration for tightening of the lower eyelid at the same time may be considered. Eyelid surgery cannot stop the process of aging. It can, however, diminish the look of loose skin and sagginess around the eyelid region. Surgery of the nose is performed frequently by plastic surgeons. This surgical procedure can produce changes in the appearance, structure, and function of the nose. Rhinoplasty can produce or increase the size of the nose, change the shape of the tip, narrow the width of the nostrils, or change the angle between the nose and the upper lip. The operation can help correct birth defects, nasal injuries, and help relieve some breathing problems. There is not a universal type of rhinoplasty surgery that will meet the needs of every patient. Rhinoplasty surgery is customized for each patient depending on his or her needs. In some situations, cartilage grafts taken from within the nose or from other areas of the body may be recommended to help reshape the structure of the nose. Internal nasal surgery to improve nasal breathing can be performed at the time of rhinoplasty. The best candidates for this type of surgery are individuals who are looking for improvement, not perfection, in their appearance of their nose. In addition to realistic expectations, good health and psychological stability are important qualities for patients considering rhinoplasty surgery. Rhinoplasty can be performed in conjunction with other surgeries. Alternative treatments to facial surgery. Alternative forms of management consists of not treating the laxness of the skin of the face, eyelids, or neck regions, and not changing the shape of the nose. Improvement of skin laxity, skin wrinkles, and fatty deposits may be attempted by other non-surgical treatments such as Ulthera, cool sculpting, chemical peels, laser resurfacing, facial fillers, Botox, Dysport, or surgery such as liposuction and internal suspension sutures. Occasionally, brow lifting is indicated instead of eyelid surgery. Minor skin wrinkling can be improved through chemical skin peels, laser resurfacing, or other skin treatments. Some nasal contour problems may be treated with temporary injectable fillers. Risk and potential complications are associated with alternative forms of treatment. Inherent risks of facial surgery. Every surgical procedure involves a certain amount of risk, and it's important that you understand all these risks and the possible complications associated with them. In addition, every procedure has limitations. Your choice to undergo a surgical procedure is based on the comparison of the risks of the potential benefits. Although the majority of patients do not experience these complications, you should discuss each of them with me if you want more clarification to make sure you understand all the possible consequences of facial surgery. We'll start with specific risks of facelift surgery. Hair loss. Hair loss can occur in areas of the face where the skin was elevated during surgery. Though unusual, the most common locations are in the temple area and behind your ear. The occurrence of this is not predictable. Nerve injury. Motor and sensory nerves may be injured during a facelift operation. Weakness or loss of facial movements may occur after facelift surgery. Nerve injuries may cause temporary or permanent loss of facial movements and feeling. Such injuries may improve over time. Additional surgical procedures such as nerve repair, grafting, or transfer may be required should you have a nerve injury. Injury to the sensory nerves of the face, neck, and ear regions may cause temporary or rarely permanent numbness. Painful nerve scarring is very rare. Use of platelet gel or fibrin sealant tissue glue during facelift advisory. Platelet gel, which comes from your blood, and fibrin sealants from human blood components heat treated to inactivate virus transmissions, may be used to hold tissue layers together after surgery and diminish postoperative bruising following a facelift. Sealants have been carefully produced from screened donor blood plasma for hepatitis, syphilis, and human immunodeficiency virus, or HIV. These procedures have been used safely for many years in cardiovascular and general surgery. These products are thought to help in diminishing surgical bleeding and by adhering the layers of the tissues together. Previous surgical scars. The presence of surgical scars from previous facial surgeries may limit the amount of skin tightening that can be produced. Asymmetry. Symmetrical facial appearance may not result after surgery. Factors such as skin tone, fatty deposits, skeletal prominence, and muscle tone may contribute to normal asymmetry in facial features. Most patients have differences between the right and left sides of their faces before any surgery is performed. Additional surgery may be necessary to attempt to diminish asymmetries. Parotid fistula. The parotid gland rests at the angle of your jaw and produces saliva. In deeper facelifts, the gland can be damaged, resulting in persistent leakage of the saliva into the facelift surgery site. This is referred to as a salivary or parotid fistula. A simple test of fluid called amylase test will determine if salivary or parotid fistula is present. Additional non-surgical treatment such as Botox or surgical treatment may be required to close a salivary or parotid fistula. Seroma. Infrequently, fluid may accumulate between the skin and the underlying tissues following surgery, trauma, or vigorous exercise. Should this problem occur, it may require additional procedures for drainage of fluid. Seroma should be addressed to prevent an unfavorable outcome. Should the problem occur, additional procedures for drainage of fluid may be required. A seroma following a facelift usually resolves with repeated aspirations. Recurrence of and signs of aging or redo facelift. A facelift is a temporary measure to improve the visible signs of aging. The exact duration or longevity of your facelift is dependent upon many factors, including your bone structure and weight gain or weight loss, genetic factors, nutritional factors, nicotine use, sun exposure, as well as techniques utilized to perform your facelift. The facelift cannot stop the aging process. It can improve the most visible signs of aging by tightening deeper structures, redraping the skin of the face and neck, and removing selected areas of fat if necessary. Distortion of anatomic landmarks. Facelift surgery may result in some distortion of your face, eyes, or neck. This may be permanent and may require further surgeries to improve. Now we'll cover specific risks of eyelid surgery. Blindness. Blindness is extremely rare after blepharoplasty. However, it can be caused by internal bleeding around the eye during or after surgery. The occurrence of this is not predictable. Dry eye problems. Permanent disorders involving decreased tear production can occur after blepharoplasty. The occurrence of this is rare and not entirely predictable. Individuals who normally have dry eyes may be advised to use special precautions when considering blepharoplasty surgery. Ectropion. Displacement of the lower eyelid away from the eyeball is a rare complication that can occur during lower eyelid surgery. Further surgery may be required to correct this condition. Corneal exposure problems. Some patients experience difficulty closing their eyelids after surgery, and problems may occur in the cornea due to dryness. Should this occur, it would be very rare, and additional treatments or surgery might be necessary. Eyelash loss. Hair loss may occur in the lower eyelash area where the skin was elevated during surgery. The occurrence of this is not predictable. Hair loss may be temporary or permanent. Finally, we'll cover the specific risks of rhinoplasty surgery. Damage to donor sites. Occasionally, the procedure will involve using cartilage or bone grafts taken from another site of the body, such as the ears, ribs, or skull. This adds risks that we will discuss with you in detail if necessary. Implants. An implant may be used in some rhinoplasty operations. Implants may become infected or exposed, requiring removal. This may occur at any time in the future. Delayed healing. Fracture disruption or delayed wound healing is possible. Some areas of the nose may not heal normally and may take a longer time to heal. Areas of skin may die and may require frequent dressing changes or further surgery to remove the non-healed tissue. Nasal septal perforation. Infrequently, a hole in the nasal septum will develop. The occurrence of this is rare. Additional surgical treatment may be necessary to repair the nasal septum. In some cases, it may be impossible to correct this complication. Nasal airway alterations. Changes may occur after a rhinoplasty or septoplasty operation that may interfere with the normal passage of air through the nose. Substance abuse disorders. Individuals with substance abuse problems that involve the inhalation of vasoconstrictive drugs such as cocaine are at risk for major complications, including poor healing and nasal septal perforation. I hope this information has been helpful. Please pause the video and find the discharge instructions so you can follow along. Please write down any questions if you would like more explanation of any of the items. We will begin on page 2 since the general post-op discharge instructions have been covered in another video. Wound care. If you have had a rhinoplasty, do not put ice packs on your nose. If you have a splint over your nose, it will be removed in the office about 1 week after surgery. Due to swelling inside the nose, most people experience a stuffy nose after rhinoplasty surgery. This will subside as the swelling decreases. It may take a few months for it to resolve completely. Keep your head elevated for the first week after surgery to help reduce swelling. For eyelid tucks, apply bacitracin or similar ophthalmic ointment to the incisions twice a day after cleaning the areas. You may apply cold compresses on your eyes or nose for the first 2 days to reduce the swelling. Apply compresses for 15 minutes on, 15 minutes off. The swelling could be the worst at 5 to 7 days after surgery and can take 3 to 12 months to resolve completely. If you have any drains, they will be removed in the office. External sutures will be removed in the office at about 1 week. Internal sutures may be palpable and can take 6 to 12 months to dissolve completely. You may shower and shampoo your hair 24 hours after surgery. Avoid having the shower spray hit your stitches directly or other surgical areas. Absolutely no smoking or nicotine use for 4 weeks after surgery. Using any nicotine products will decrease the blood flow to the surgical area, which will delay normal healing processes and could result in wounds opening up and even skin death. This could result in further surgery. A responsible adult 18 years of age or older should remain with you for at least the first 24 hours after surgery. Call us immediately if you experience persistent or increasing pain not relieved with pain medications or high fever over 101 degrees Fahrenheit. Call 911 immediately or go to your local emergency room if you experience shortness of breath, sudden sharp chest pain, especially if made worse by deep breathing or cough, painful respiration, new onset of wheezing without any prior history, or if you have experienced any seizure without any prior history. We hope this information has been helpful, but feel free to ask any questions if you should have any further questions or concerns. Thank you for watching. We look forward to helping you achieve your desired appearance.